And I'll try to highlight them here if I have a, oh, I do. East Vista Way, that's Tradecraft, Urban Leaf. This one was, I can't remember the name of it, right across at the corner of Hacienda and La Tortuga, which just recently opened. This one's in the Vaughn Center, further down Santa Fe, Riverside. This one's right at Monte Vista. Not remembering the name of this one. Yeah. And this is Hillside Holistic on Sycamore. This one's off La Mirada, and then there's 2 down in the business park that are in the industrial area. These 11 locations have all been permitted and are all operating. Those would be the only locations where adult use cannabis could establish. There's also operating standards that are included in the municipal code amendment. It was not provided to the commission, but it addresses a number of operating requirements which are listed here. If you have any specific questions about how things will be handled operationally, we'll be happy to go through those for you. So in summary, the staff recommendation is to amend the chapters of the development code that are referenced here, Chapter 18, the zoning code, as well as amend the Vista Business Park specific plan. Your recommendation would be a recommendation to the City Council to amend those zoning classifications. And those ordinances would be scheduled for the City Council's consideration on June 22nd, next Tuesday. That completes my staff presentation, and I'm available for any questions. Thank you.
Very good. Thank you. Commissioners, you get to use your machine tonight. If you have any questions, press your button, and I will call on you to ask questions. And Commissioner Looney.
Thank you. John, could you define adult use?
Yeah, it's in my presentation here. Actually, the definition is exactly as it says here. A location where cannabis is provided to individuals who are 21 years and older.
So as far as provided to individuals, is it the equivalent of a bar, but rather than serving alcohol, they serve cannabis?
Yes. So you have to be 21 to purchase, so they check your ID before you go in. You can purchase it there, but you cannot consume it. So there's no consumption on site. It's only purchasing and taking off site. Correct.
Okay.
The city's rules prohibit any consumption on site.
Okay. Thank you. That's what I was looking for.
Yeah.
Okay, Commissioner Grimm. There we go.
It's all right.
That better?
Thank you. Yeah, thanks.
When you first look at this, the first thing you see is that it's, it's provided by right in the zones. I guess my question would be, I assume that it's going to be treated then the same as alcohol pretty much, in that you're going to have further operation requirements, licensing requirements. Is that kind of how it would
It is
work?
treated a little bit differently than alcohol in our code just because of the way Measure Z was set up. So Measure Z establishes a use by right and then applied the licensing requirement. For alcohol in our code, we require a land use approval, so you have to get a special use permit. Those all come to you. So there's another level of review that's required for alcohol. Had the city done this on our own, frankly, I think we probably would have gone down that road and gone through a land use approval, but because it was established by the voters and it was already set in stone, we're following protocol to just add on to the allowance, but not change the way it was established, because it would add another layer of approval for adult use that these existing medical storefronts didn't have to go through before.
Okay, thank you.
Beth?
I have no screen, but I have a mic. One thing that was mentioned in the staff report that I read was that because this is handled through Measure Z, there is no impact on the general plan. Would there ever be an impact on the general plan for treating these particular institutions?
So cannabis is not directly addressed in our general plan. There's no policies related to the establishment or operation or regulation of cannabis dispensaries. I think largely because when we updated our general plan in 2012, it was not a real thing. I'm guessing when we go back and do it the next time, which we're going to start next year, we'll have some policies that address it. But as far as right now, there's no consistency issue because there's nothing that specifically addresses it. As far as health-related concerns and things like that that are more general in nature, there are a number of policies in the general plan that address that, and social service provision, that kind of thing, but not directly related to cannabis.
Thank you.
Commissioner Garrettson?
Yes, I just want to make sure I'm clear. This is a city council initiative, not a voter initiative, which proposition or Measure Z was.
Correct.
So this is city council, and it basically approves all 11 existing dispensaries or shops.
No, makes them eligible
Makes
for
them
another
eligible.
license to sell adult use cannabis.
Okay.
But they don't automatically get it. They have to go through an approval process.
So is there any reason to do this other than financial?
I think that's opinion. I don't really want, that's not, yeah, that's more of a council question than a staff question, I think.
I'm just trying to figure out why this is even before the planning commission.
Well, the zoning action has to come before the commission, so anytime we make an amendment to the zoning code, the state law requires us to bring it before the commission for a recommendation before it goes to council. That's state law. So it's a zoning change that we're making today by changing our C zones and the other zones to allow adult use cannabis. Anything that changes the zoning code comes before the planning commission under state law.
Okay. So this would make it legal to do production, growing, manufacturing, testing, delivery, and retail?
No,
No.
this is strictly adult use retail. There are some definitions being added that clarify the other already permitted cannabis uses fall under a certain category, which is called a local cannabis license. But the action that you're taking this evening is really strictly related to the permission for adult use cannabis to establish a process that allows the existing retailers to get adult use cannabis through an application process.
Thank you. I wanted to make sure that got established
Yeah.
for the record.
Thank you.
Commissioner Aguilar?
So you just said that it's not going to be, just because you have a medical marijuana license, it doesn't automatically guarantee you get a recreational use. But on this local cannabis license, it says it covers both medical and adult retail, delivery, manufacturing, distribution. So could you?
That's just under the definition. So the definition's being added in our code to clarify that there are permitted cannabis uses, which are the licensed one. That's medical, now adult use, potentially manufacturing, distribution, delivery. And then there's non-permitted cannabis uses, which is anything else related to cannabis that's not legally allowed. So we established that definition so that we can clarify the difference between those that are allowed and regulated and those that are not.
Got it. Okay. I think I got it. Thanks.
I guess my concern, and I appreciate your comments about if staff had been asked to do this or we had started down the planning route to this, I'm concerned about the licensing provisions. Is there any thought that those would ever go away through a court challenge or maybe a Proposition AA that would rescind Proposition Z? Is there?
So, thanks for the question, Chairperson Rossler. The way we are going to set up this ordinance, the state law would be supreme over the local. So if the Prop 64 or any state law or federal law is passed that would be enforceable against the city, obviously this right would disappear. So we are not going to be able to contravene any higher law. So we, and it's would be understood in the application process that this is, being provided because state law now allows for it. But obviously, if the state law took it away, that right would go away.
Okay, all right. Any other questions for staff? All right, this is a public hearing. I have one speaker slip, Barbara Gordon. We'll open the public hearing, and the floor is yours for 3 minutes.
Okay, thank you very much. Good evening. I appreciate the opportunity to speak with you. My name is Barbara Gordon, and I'm here tonight to express my concern as the city looks to move to recreational marijuana. As the adult advisor of a Hispanic youth group, our teens are always watching what we do. We cannot put more drugs in the community and then expect no harm will come. Since marijuana legalization, the medical community has published thousands of articles related to the harms being seen with this product. Dr. Ronette Love, who is the chief of emergency department at Scripps Mercy Hospital, she also chairs the Emergency Medicine Oversight Commission with the San Diego County Medical Society. She shares with her recent experiences. She says, the volume of emergency department visits in San Diego related to marijuana has increased 830%. There has been an increase, there is an increase in public perception, she says, that marijuana is a relatively harmless drug. But the public perception is wrong. Every day, she says, I see patients with psychosis, anxiety, palpitation, chest pains, all due to marijuana use. I know the city is looking to increase revenue by allowing the sale of marijuana, but at what cost to the city when you factor in staff time to oversee the permitting process, allocate of enforcement resources? The city of San Diego had to budget $1 million just to manage their Cannabis Bureau division. Chula Vista, the city of Chula Vista, had to hire a criminal attorney just to handle all the marijuana litigation they were dealing with. I'm just asking that this commission and the city council please move cautiously and listen to the health professionals who understand the risk of marijuana policies that you guys are advocating for, instead of listening to the marijuana industries who puts profits over people's health and safety. Thank you very much.
Thank you, Ms. Gordon. I have no other speaker slips, and seeing no one else, I'll go ahead and close the public hearing and then open it up to commissioner discussion. Commissioner Grimm?
Yeah, just speaking to what Mrs. Gordon just said, the ball on this one has kind of been handed to us by others, and so I will support the motion, but I do have a lot of concern about, especially about, not so much about adult smoking, but about it getting to children. As Mr. Rossler alluded last week, I grew up in the 40s, but not really. But even back then, alcohol, cigarettes had no problem getting down to people, kids that were in, 10, 12, 13. And I'm worried the same thing's going to happen here. And the studies have indicated not so much on adults, but at least the studies I'm familiar with, more on children. There's some severe effects. So that's my concern. But again, because this ball was handed to us by others, I will support the motion.
Commissioner Garrettson.
I oppose this. I do see that it would increase the revenue and it would decrease the illegal use or the illegal sale. I think this is not a public initiative. There's been no public input, no health professionals' input, and it's happened too quickly. So I will oppose.
All right. Anyone else? Commissioner Aguilar?
Yeah, I understand with what my colleagues' concerns are. I've been down this road a couple years ago when I opposed it. One of my concerns was similar to Commissioner Grimm's concern, and that is access to children. My biggest concern was medical marijuana was available to 18 years and above. And since that vote that we took, I started to realize that we probably should have went down the recreational, because that was 21 years and older. And in all reality, it is recreational already. I mean, the medical marijuana initiative at the time was really just a farce to get it out there. I mean, there's kids, unfortunately, getting a hold of this at this time, and anybody can get whatever medical requirement is necessary to access cannabis. And as far as the lady's concerns out there about monitoring and the licensing and administration and those costs, I feel like we already have those in place, all the processes and the people in place. And I know council is looking at this mostly from an income perspective, and it has brought a lot of income to the city of Vista. And I believe that this is just one step closer to the city actually regulating what happens in the city. And, I will be supporting it.
All right. Beth? All right, that concludes our discussion. Would someone like to make a motion?
I'll move staff recommendation.
All right, is there a second? Commissioner Hastings, second. So it's been moved and seconded to approve staff recommendation. We'll do it by a hand vote. All in favor, raise your hand. 3, 4. Approve and opposed? 2. Commissioner Garrettson, would you like the minutes to reflect why you were voting in opposition, or just the comments that you had made previously? Okay, all right. And I agree with Commissioner Garrettson's comments and Commissioner Aguilar's concern and Commissioner Grimm's concern about spreading. So I didn't vote for Proposition Z. I don't think it's a good thing for our city, and so that's why I voted no. So, all right. That concludes our public hearing, and we will move along then to reports from commissioners. Any comments or reports from the commission members? All right, Mr. Conley, your report, please.
So we want to welcome everybody back to the council chambers. First of all, it's nice to see everyone in person again. Hopefully we stay this way. There are some benefits to the virtual meetings that I thought was nice to have, but I certainly appreciate having the public forum. So welcome back. We took it easy on you tonight with one item, but the next meeting will not be as so easy. I think we have 4 or 5 items staged for July 6th. Yeah, that's our next meeting. So,
I'm sorry, July
6th.
6th?
Sorry, in person in the chambers here, 6 p.m. The council will meet next Tuesday. There's a lot of stuff on their agenda. The housing element will go to them for final approval. This amendment that we talked about tonight will go to them. The VOZA project on Taylor Street that came to you last meeting for recommendation will go to them for final review. And then we're working on an annexation of the Mar Vista Island, which is an area bounded by Mar Vista and Buena Vista. It's about 140 acres, Marine View and Miramar Drive, that general area that's in the county. And that'll be coming to the council for a public hearing as well. It would have to go to LAFCO after that, but we're cleaning up some boundary issues. So those are 4 public hearings on next Tuesday night. We'll also have a discussion on a proposed rezone at North Santa Fe and Camino Largo. If you remember, there's about 8 or 9 acre parcel there on the east side of the street where the nursery is that was annexed into the city in 2018, along with a 8-lot subdivision, and they're looking to rezone the property to a higher density, and so that'll be discussed at the council meeting on the 22nd as well. And I don't have anything else. Did you have anything you wanted to add, Patsy? No, that's it. That's our update.
Okay. Commissioner Aguilar?
So in that annexation, will Stonegate project be part of that as well?
Yeah, that's what sort of initiated the whole thing. The Stonegate project, when it was first developed, was brought into Buena Sanitation District for sewer service, but it flows into Vista. We had a moratorium on annexations at that time, so now that the moratorium's gone, we really feel like it's appropriate to put it in the correct sewer district, so that's what triggered the whole thing. Once you take that out, you get a much smaller island, and LAFCO policies support bringing it all in as one, so we're looking at the whole island. Stonegate's the southern part of it, and then Marine View, Miramar's the northern part of it.
Oh, good.
Very good. Any other comments or questions? All right, seeing none, we will stand adjourned until July 6th. Thank you very much.
Thank you.
Thank you.